Let's get to the details of those stories now. Over 200 patients of the Ankaful Psychiatric Hospital are stranded after nurses laid down their tools this morning. Staff have locked out their patients in a protest demanding the removal of hospital's director, Dr. Eugene Dodoi, from office. The nurses say 3 weeks after they petitioned the Health Ministry and the Ghana Health Service over development at the facility, nothing has been done about their grievances. JoyNews' correspondent Richard Kojo visited the mental health facility and has more in this report.
So I am right now at the Ankaful Psychiatric Hospital. I am in front of the Dr. Kwao Ama Elu OPD complex, and this is where when patients are brought in, they are sent to, so they have to take their medical records and the other things and be taken care of. But today we come to witness that the workers, the nurses group and other paramedics in this facility are not working. They say that it is a sit-down strike, so they have suspended all the activities. Now they are not giving them medication, they are not attending to outpatient people that have been brought currently. And I mean, so there is frustration written boldly at this facility. You can see that a lot of relatives have lined up here. They want services to be provided to them, but they are not getting. The nurses tell me that they want the medical director, Dr. Eugene Dodoi, out of this facility. They have cited instances of oppression, lack of respect, and he does not even trust them. He embarrasses them in front of patients and their relatives. People that have also been here are saying that the man is not friendly, his human relations are not good. They've had a number of medical directors, but this one is so different. And the Mental Health Authority knows about this situation and is not doing anything.
We wrote a petition to the Health Minister requesting that he removes Dr. Eugene Dodoi as the hospital director. And the petition was written way back, I think, 20th of October. And as it stands now, the man is still in office as the hospital director. And as a result of the staff of the hospital, initially they were saying that it's only nurses. But when you take a look around, you see that we have the casual, we have the orderlies, the ward assistants, the pharmacy, the labs, and then let's say all the paramedics are around. And then what we are saying is that until the health minister takes Dr. Dodoi from office as the hospital director, we are not going to work in the facility again. Currently, OPD is not working. We are not taking care of the inpatients and then outpatients. We are not taking care of the outpatient, and then we are not attending to emergencies at the OPD as well. But for the ward, we are there. We will go and write our names, and then we will attend to only emergency cases on the ward. That is, we are not going to serve medication. We are not going to serve patients their meal. We are not going to write any reports and then any changes as well. So what we are going to do is that we are going to wait for the minister to, as it were, respond to or take out the hospital director. But if he insists that he maintains him here, what we are going to do is that come Monday, we are not going to come to work at all. We are going to have a total sit down.
Aren't you taking this issue too far, to the point that you are not serving medication to the inpatient and you are not attending to the people that have come from far and near to bring their wards to the hospital?
Yeah, that was the reason why we started this way back October. We didn't want it to get to this point. We had actually petitioned and we have had so many meetings with leadership to at least avert this situation. But it seems all our issues are falling on deaf ears. That's how come we've reached this point.
We are not taking it too far. Seriously, our rights, our human rights have been abused. They are actually, stretching, back and forth. And if they want us to go that way, we'll surely go with them.
Are you disappointed that, you started this one on the 20th of October?
Very, very much disappointed. Nurses are not respected in Ghana. Seriously. You come and then you check in vitals, a digital thermometer, and then you give a recording that the digital thermometer has given. And then the director will tell you that he doesn't trust that. In front of patients and relatives, he tells them that he doesn't trust nurses. Come on, when you do that, the clients don't have any kind of confidence in the nurses, making us feel like belittling us in front of patients, relative junior nurses, even to the extent that extending it to our DDNS. We won't take that from anybody. We won't take that.
So the bottom line is that you want the medical director to...
He should go. He should go. We can't work with him.
Has become a Mugabe on the soil. And we are telling the whole of this country that if Dr. Dodoi is not removed, the struggle will continue unabated, because we are feeling the heat and we will not tolerate him. And we are health professionals. Some of us are gone to school through university to places, and he, Dr. Dodoi, is not the reservoir of knowledge in health. And if the mental health authority begins to protect Dr. Dodoi, in fact, psychiatry will go down. So it's better they allow Dr. Dodoi to leave, because psychiatry is not for Dr. Dodoi, and Dr. Dodoi is not psychiatry, for peace to prevail. As you can see, paramedicals, all the nurses, all the adjoining staff are on board this one.
If we are mental health care providers, we are caring for the mentally challenged, and right now we don't have sound mind. How then do we care for the mentally challenged? So it's a problem here, and this man has been shielding him. He came here during this brouhaha and said that even before the group, the psychiatric nurses group, petitioned their outfit, they had about 17 issues, 17 petition letters and complaints, and even went ahead to say that he personally had text messages from the staff here complaining about the behavior of our director here. So the question now is, what was he doing? If you really care about the staff here, if you really think that our director is your personal friend or whatever, you should have come down here to look at the situation and resolve it. But now here you are going around telling people that they should come and beg we. We are never going to agree. There is no turning back. If you accept this man here, he's going to kill it. He has made it to us that he's never going to change today. He will not change tomorrow. Then they do be pure.
If I saw me check up, me hospital. Now me cook master. I share me 2 weeks into a year. Me apart when I'm sending me check up. Me buy I say yeah, a strike. Just say nyame anye ya adoma mpanifo amamni ahwe de anche se abetwa kwansi mu. Nyame no na bebe mu. Nti de ani ato nyame so. Nyame be mu de ai bia na wo mo ahwe ye ne. If you take in a buy.
This woman comes from Kumasi and she came here, for a checkup. She's been coming here, and this is the hospital she's been coming to. She comes here often, but today she came and then they said they are not working, they are not attending to them. So she is appealing that if help does not come, if no intervention comes, then it means that they would have to go back without them being worked on or being checked. Then they do appear.
My school, Asante Mampon, Second University. Now me get do man. Until a bread with some baba get do. Me free a boss, Western region, Namamba. Me do a tutu abubunim say a strike. In fact, me bands who are made with that will cry happy. Me damn that because of covers for Asante Mampon. I said, you know, born home by Akudus, my band 7 years in 7 years in intimate per se, men per se, Yarian Bessa, and Ban should be. Timbaya, Yatuchum, Ahampa, and I did here, my Bassam, Detian.
So this man comes from Takwa Boso in the Western region. He comes here often to get some medication for the child, the son, who attends a university at Tech. And that is what he does regularly to prevent an occurrence of what happened to the son some time ago. And he appears very frustrated, and he wants the intervention of medical authorities to help him get the medication, because he does not want the situation or the son to suffer any relapse.
Yeah, bank I beg you or kasa na azinti kay beg you by was strike. Na yes it's na ha monum sisi aye kofia muhuma o kwa kay wofi nti wa mama aye basa na mezitina ha
Kasa then
there on ye kasa ne ye papa on ye normal kasa.
Health Minister Dr. Kwajima has been responding to the situation, that rather unfortunate situation at Ankaful.
We have sent the Acting Director of Health Training Institutions with another person from HR in the ministry to visit the place. The Chief Executive of the Mental Health Authority, Dr. Kwesi Osei, has also visited. As at yesterday, I gave instructions that they should invite the aggrieved nurses, their representation, to come to meet with me in the ministry, and we will engage in dialogue. I believe where they are by today, they may have taken, apart from the phone calls, they may have received a letter signed, and we are expecting them to come to a ministry on Tuesday morning. I believe we can resolve these matters. It is not a matter of service condition issue. It's a matter of personality clash with the chief executive of the place. And some disciplinary issues are involved. I don't want us to open our dirty linens in public. We will meet with them, and I believe we can resolve the matter amicably.